Research suggests that almost half of women and almost a third of men will have a DSM-5 sexual dysfunction in their lifetime. Concurrently, the classification of obesity is now impacting more than a third of men and women, which has been related to especially negative consequences for women in societies that emphasize the ideal of being thin. It is important for clinicians, researchers, and theorists to understand the relationship between obesity and female sexual concerns from the words of those who have lived experience. The problem addressed in this study was that females with obesity internalized harmful cultural messages that engendered negative sexual experiences and attitudes. The purpose of this qualitative single case study was to explore and examine the meanings and perceptions of the sexual experiences of females with obesity who resided in the same city in Western Canada. There were 2 themes that emerged from research questions 1 and 2, and 3 themes that emerged from question 3. Research question 1 asked, how do females with obesity perceive their sexual experiences in the context of their weight and size? The second research question asked, how do females with obesity perceive the cultural messages about their bodies and their sexuality? The third research question asked, how do females with obesity struggle differently with perceptions about their sexual enjoyment and satisfaction? Regarding research question 1, a conclusion was that unless there were also protective buffering factors, such as feeling attractive or confident in some way, or positive childhood messages from parents about obesity, the avoidance of dating and sexual intercourse was not based on choice, but rather a sense of forced passivity. Additionally, participants noted that body confidence and appreciation did not always translate into better sexual experiences, suggesting that they were partly independent phenomena. Regarding research question 2, a conclusion was that society's lack of positive representations and limited change told women with obesity that they were not attractive and that they should be invisible in society. The interview responses to the third research question seem to express potential buffers to the cultural imperative that females with obesity be invisible in society. If a participant felt attractive or confident in some way, they expressed less inhibited sexual behaviors in the context of their body weight and size. This conclusion fits within the context of the literature review that found body appreciation to be a potential buffer to the negative cultural impacts of a preference for thinness, but that this buffer may not be enough to positively impact feelings of one's body in a sexual nature consistently. Another potential buffer to the cultural directiveness of invisibility appeared to emerge from this last theme, suggesting that positive childhood messages about obesity from parents could, similar to buffers of attractiveness and confidence, help to combat the cultural messages of invisibility and the resultant avoidant behaviors. Future research and clinical practice will hopefully continue to provide clearer guidelines regarding how best to support females with obesity in their sexual health without contributing to stigma and discrimination. Thank you for listening.